no change from what we saw last week. Nonetheless, I will ask for a moment of silence for those who have been lost during this health crisis. Thank you. I want to be a broken record on this because I think it's very, very important. If you have a smartphone, we are requesting that you download COVID-Wise to your phone. If you get a notification of exposure, then there are plenty of options available to you after using COVID-Wise. So I've obviously asked those who are students to download this. Residents, please download as well. I think it's just a good tool to have at the ready. As I stated, there are options available to you if you know if you hear or have been notified of a potential exposure. This week's testing options are available Thursday, September 10th, 4 to 6 p.m. at Hotchkiss Field Community Center on the north side. Also on Saturday, we have an option available to residents at Fairfield Middle School, and the operation of the testing site will be from 9 to 11 a.m. As always, remember these testing events are available to the broad public regardless of insurance, citizen status, mobility, geographic location, and obviously if it would make you or your family more comfortable, or even your employer more comfortable, we request that you go ahead and get tested. It's free. Please go get tested at one of our sites. Also, masks continue to be mandatory. It is mandatory that you use a face covering. I'm not using one right now because I'm speaking to you as the public, but once I'm done right here, I'll be putting this mask right back on, and I want to applaud each and every resident who has adhered to the mandatory mask policy that we have here in the city of Richmond. We're grateful for your help. Obviously, we are able to reduce the transmission of COVID-19 by wearing a face covering. They come in different sizes with different designs and whatnot. You can get one that fits your personality, but it's the only way. I think this is the strongest tool we have right now to fight COVID-19 is by using your mask. So I will continue to be a broken record and ask you to wear your mask and wear it properly, covering your nose and your mouth. And as always, continue to wash your hands and continue to social distance as well. And for all those students who are back here in Richmond, who are VCU students, University of Richmond students, Virginia Union students, if you're living here in the city, we still ask that you adhere to the policies that we don't want you mass gathering at parties or whatnot. After you've done your virtual learning online, we ask that you stay away from gathering in mass events. That is not only to protect yourself, but also protect the community at large as well. That, once again, one of the tools that we have in our toolbox to get us through this pandemic is us taking a little bit of personal responsibility, and that means wearing a face covering, washing your hands, and keeping good social distance. And with that, I'm about to hand it over to Dr. Danny Avula, the director of the City of Richmond and Henrico County Health District. Dr. Avula.
Thank you, Mayor. Good afternoon, everybody. Our pandemic metric dashboard will continue to show that the central region is still in a high burden fluctuating trend, so substantial transmission throughout the central region. Here in the city, our case rate has been about 16 cases per 100,000 population, which is actually a decreasing trend. We've had a sustained decreasing trend over 10 days now in terms of our case rate. Our percent positivity tells a different story. We're up to 7.8%, and that has been ticking upward over the last 15 days. Now, I do have some concerns about our percent positivity because percent positivity is dictated by a numerator, the number of people who test positive, and a denominator, the total number of people tested. And what we're seeing, especially over the last couple of weeks, is that the negative tests there's a delay on getting those into the system. And so right now, I do think our denominator is is falsely low. We've got to get caught up, and this happens at the state level where a lot of these negative test results get logged into the state database. So I imagine we will see some correction on that percent positivity. So I don't want to rely too heavily on what those current numbers look like. I also do think that as testing becomes just more and more widely available, that percent positivity is pretty sensitive to a few indicators. Like when we have a big outbreak in a facility, that is going to shift our percent positivity pretty drastically. And so, as I've been working particularly with the school systems here in Richmond and across the line in Henrico, we've really impressed upon the importance of incorporating both percent positivity, but also a host of other metrics around decision making. Also in the city, our number of outbreaks, our rate of outbreaks has been increasing over the last 30 plus days. So we are seeing more cases and we are seeing more clusters, although a decreasing trend in cases per 100,000 individuals. Other good news, we've built this navigation program where we identify individuals who need financial supports, who need housing supports, where they're not able to effectively isolate due to COVID. So our navigation team has been running strong for this last couple of months, and we just reached a milestone this week that over 500 people have been successfully navigated to various services for COVID supports this week. And my last thought is just to reassure the community that our efforts to decrease the spread of COVID rely heavily on our ability to case investigate and contact trace, and then to help people quarantine and isolate. And I just want to say that has been working. In the month of August alone, we completed 416 investigations for cases that were working in facilities or different workplaces. And the vast majority of those were single cases who worked while ill, but were identified quickly, were quarantined quickly, and no new cases were developed from there. So I just want to reassure the community that the core public health intervention of case identification, contact tracing, and quarantine and isolation is doing its job. So we're really encouraged by those numbers through the month of August and hope that persists through the fall and winter. Thanks.
Thank you, Dr. Avula. Today, I am excited to announce the first stage of our emergency child care program. A couple of weeks ago, you heard that there were a survey done, and we heard about the need from our families who are helping with their children attend virtually at the beginning of the school year. The city of Richmond has moved forward in a partnership with the YMCA of Greater Richmond so they can go ahead and open up 2 non-school sites. Those 2 non-school sites will be Movement Church in the West End and Battery Park Church in Northside. Movement Church in the West End, Battery Park Church in the Northside. As I stated in the past, the city is using CARES Act dollars to help fund spots at those 2 centers right there. The YMCA is obviously a trusted partner to help us launch our first leg of this child care program. YMCA also has helped us in partnership with us expanding after-school programs here in the city of Richmond to elementary schoolers and middle schoolers, and they are going to be partners here as well. They're going to be partners here as well on our child care program too. Now, the cost to attend will be $33 a week. And to register, we ask that you go to ymca.org and look for the Student Success Centers. And I want you to know we continue to work with Richmond Public Schools to move into the next phase of our emergency child care offerings at some of our opening school-based sites. We're working on an MOU with RPS right now, and we want to ensure that we want to ensure that facilities are sufficiently clean, and that's something that we're working collaboratively on with RPS. Now, for the city's part, we're ensuring that if you receive any public benefits, Medicaid, TANF, SNAP, then you are categorically eligible, which means your child can go have access to this child care for free. For free. Even if you aren't categorically eligible for emergency child care, financial assistance will also be made available to those families. And we cannot start registration for those programs until we're given a firm date. We do have a firm date. We are going to open up this month, and so we're firming up that date. We don't have the exact date, but it will be sometime in the month of September. And we look forward to continuing our dialogue alongside RPS to make this a reality for some of our families who are facing the hardship and have to make that choice between making sure their kids get a quality education and they can go to work and put food on the table and keep a roof over their families' heads. And so I want to ask now the second day of school, Mr. Cameras to come up and just give us an update on where we are with the Opening with Love plan. And second day of school, thousands of kids are on their Chromebooks right now, being taught by some of the finest educators in Central Virginia and the Commonwealth of Virginia. And Mr. Cameras will give us an update on that.
Good afternoon, everyone. Thank you, Mayor. We did it. RPS is open. We have reopened. We have done so with love, as we said we would, and I'm just so thrilled, so grateful to our teachers, to our principals, custodians, bus drivers, counselors, social workers, everybody else who made this possible. It really is, I believe, one of our finest moments, and could not be more grateful and more proud. I also want to say thank you to our families. We know this has been a difficult time, managing work and personal lives and overseeing your children, and we just want to say thank you for your partnership and your support. And most of all, to our kids, we are thrilled to have you back. We love you, and we are excited to be working with you this fall. A few notes I do want to make. As I have shared before, our mantra for this first week is low stress, high grace. Low stress, high grace. There will be no graded assignments, no tests, no curricular launches, no penalty if you miss class due to tech issues. The goal of the week is simply to work through the log-on issues, get back into the groove of being in school, and most importantly, to begin developing relationships with students and with teachers, and to begin to nurture the community in our schools. I do want to note just a few details for anyone who still does not have the meal information, the meal distribution information. Just go to our website, rvaschools.net/meals, or you can just go to the homepage and you'll see right there on the homepage is an icon with a lunch bag that has all of the information. We have hundreds of stops all across the city every morning. I've had the good fortune of going to a few of them. Rain or shine, the folks will be out there providing those meals. If you are still having any issues logging on, a couple of things to note. You can email us at helpdesk@rvaschools.net. You can call our family support line at 804-780-6195. And this week at Clark Springs and Huguenot High School from 8 a.m. to noon, there is in-person support as well. And then finally, if you need anything else or if you're having any issues, don't hesitate, as always, to reach out to me directly at jcameras@rvaschools.net. Thank you.
Once again, Mr. Cameras, I'm going to take the privilege just to applaud you and your team and all of our teachers and the families as well. Starting an academic year remotely is a huge undertaking, Making sure 25,000 kids show up on day one and continue to show up throughout the week is a huge undertaking. And so I want to tip my hat to you and your team and applaud the good work. And we got 178 days remaining. And obviously, you know, the city stands ready to help any way possible. So thank you. Now I want to just take a moment to talk a little bit about the other crisis that we're dealing with at this time, and that is, you know, we're dealing with a housing crisis as well because of COVID-19 and the pandemic. You know, the Virginia eviction moratorium ended on September 7th. And I have to stress this, you must pay your rent if you can, because you are no longer protected by the courts from any sort of legal action. But there are a couple of options for you if you have a loss of income or have been impacted by COVID-19, the COVID-19 pandemic. If you are at immediate risk of an eviction, contact the City of Richmond's Voluntary Eviction Diversion Program. You can apply online at rvaevictions.org or apply by phone at 1-833-663-8428. That number again, 1-833-663. A lot of sixes in here, gotta say. Let me start all over one more time. 1-833-663-8428. And then press 4 and leave a message there. If you are not at immediate risk of an eviction, but need help paying for your housing, you need help paying the rent, we ask that you call the Virginia Rent and Mortgage Relief Program hotline at 804-644-2401 and leave a message. And the reason we're saying leave a message because we have been inundated with a number of calls into both of these hotlines for folks who are seeking help with this current hardship. I want to remind folks that the City of Richmond has dedicated roughly $14.5 million to rent and mortgage relief and also to eviction diversion as well. This is a priority for us right now. We are in the middle of a health crisis, and we believe that all individuals living in our city should have access to a home during this health crisis. It's our top priority. And we want everyone to be able to stay in their home and be able to practice good hygiene while there as well. With that, we'll take some questions.
Mayor, could you talk about maybe, I didn't hear, a number of slots available in the program at these two churches, if you guys know that yet? And then also just talk about the need for this emergency child care, and is a situation where, you know, you have a house with both parents who aren't home, that's who takes advantage of this, and, you know, uses this kind of program, you know, what are those qualifications, I guess?
Yeah, I do not have the number of slots for you. The question was, you know, do we have the number of slots at the two places that we announced earlier, the one in Northside and one in West End? I do not have, but we can get you that number. And for eligibility, as I said earlier, that, you know, we are, it's open to RPS families. We obviously want to our families who are normally on using some sort of benefit, TANF, you know, you name it, that they have opportunities to have access to this emergency child care, and that access will be free. And it's for those families, like, you know, I saw one of the stories here on one of the networks. I can't remember which network, but, you know, she, a resident of ours had 5 kids, I believe, and, you know, she got through the summer by having her mother come and look out for the kids. But now we're getting into the fall. Grandma still has to work. She has to work. The schedules just don't work out well when you have 5 kids and you're worried about, number one, their safety, but also their well-being in terms of, are they getting a quality education? They're getting the quality education across the computer. However, there needs to be an adult there to take care of the children. And that's what we offer here in terms of emergency child care. And for a lot of our families who are living paycheck to paycheck, who are a part of the working poor as well. This is critical. This is critical. They go to work to keep the lights on, right? They go to work to ensure that their kids are have a healthy meal at home as well. And if they can't go out there and actually make money, make a living, becomes very, very difficult to stay in your home. That's why we have $14.5 million, in eviction, diversion, and rental relief. And so it's an unfortunate compounding effect, and the city's doing everything we can to just ensure that people do not fall through the cracks.
Chris? You mentioned that CARES Act funding, city has received is being used to pay for this. Do you have a figure for how much this will cost?
Yeah, we're using, the question was asking about the CARES Act dollars we've dedicated to emergency child care, and that figure is $3 million.
Yeah, is that for the two churches or for all?
That's for the whole program. So once we are able to basically build out the whole program, we'll be using $3 million in CARES Act dollars.
And if you can remind me, is that 5 schools right for now?
Yeah, 5 schools have been made available by RPS. Obviously, we have some ongoing dialogue with RPS on the build out of those programs alongside some of our partners as well. YMCA, RBHA, Richmond Behavioral Health Authority is also a partner too. We'll have other partners as well at some of these facilities. We're working as quickly as possible to create this option for our families because we know it's necessary. So you wanted, Henry, you wanted to know the number of spots. I think it's 100 for the 2 churches, so 50 per church, per site.
Rachel?
Mayor, amid a health crisis, there's also been a surge and uptick in violence over the last 3 weeks. Is this a concern for the city? And then what is being done to kind of correct this?
Yeah, the question was, in midst of a pandemic and a health crisis, we've also seen an uptick in violence in the city, in particular parts of the city, and it's just been gun violence, actually. And, what we've done is we've deployed more of our resources to those neighborhoods that have been facing an uptick of this gun violence. The ability for us to move some of these resources around I think is critical right now because I think that no family should have to worry about whether or not their kids can play outside or they can do any activities outside after a certain time of day because of the fear of gun violence. Overall, though, as I've stated time and time again over the last 4 years as mayor of the city, is that essentially we have too many some of our neighborhoods have access to too many weapons. And we have to, and in a lot of neighborhoods, black and brown neighborhoods are inundated with firearms. It's just too easy to access a firearm. I'm grateful to my friends in the General Assembly who've begun to restrict this sort of access and create stronger gun laws here in the city, but we have to go further. We have to go further. Obviously, our number one priority is the health, safety, and well-being of our citizens. And so the Richmond Police Department will have even greater presence in some of these areas that have seen a reported uptick. And I want our residents to know that if they see something, say something. And in case of emergency, please call 911 right away. I don't care if you hear something and if you hear a gunshot, you got to call 911. That's just the bottom line.
Cole, do you have a question? You good? Henry, you good? Chris?
Just to kind of go back to the $3 million allocation for the child care program, how much specifically is it for the 2 churches that's going to be put there?
I don't have that specific number, Chris. The question was how much specifically for the 2 churches who are launching the first leg of our work. I don't have any specific numbers to that, but we can certainly find out.
And then is there any other private partners, locations that you're working with other than schools?
We are, you will see some other private partners involved in this effort as well. Some of the private partners will likely be there to offer the child care services, not necessarily the sites. We're just now where we want to at least work with YMCA to offer these first 2 right away because I think we heard a need of from a lot of parents as they started school yesterday that folks don't know how they're going to get through the week. And so right away, we got 2 sites. I think that's a plus, but we're going to work as quickly as possible to get those other sites up and running, and so kids and their families can have a little peace of mind. So with that, if there's no other questions, everyone stay dry, stay safe, and stay strong. Thank you.